Good morning and welcome to Breastfeeding Buddies. My name is Natasha. I'm a registered dietitian and lactation counselor for Tri-County Health Department, WIC in Aurora. Today I'd like to talk to you about how to go about weaning your older baby or toddler. I love getting asked this question because it means that you and your baby have been experiencing the benefits of breastfeeding for a while. And there are several benefits that are particularly beneficial if you've waited to wean beyond 6 months, but especially beyond 12 years. So before I get into the tips on how to wean and how to do so successfully and hopefully a little pain-free, I'd like to tell you about the benefits of waiting to wean. So especially beyond 1 year, you will have decreased the risk of acute illnesses like respiratory and ear infections, as well as diarrhea. And in many countries, diarrhea can be a cause of death for infants, and so it's really beneficial in other countries. We see that sometimes in America, however, that's a great benefit. And then you've actually decreased your health risks as the mom if you've breastfed beyond a year. For babies who have never been breastfed, or especially if they're weaned before 12 months, they may have an increased risk of developing diabetes, type 1 and type 2. Type 1 is the insulin dependent, and type 2 can sometimes lead to insulin dependency. And they also have an increased risk for lymphoma and celiac disease and other gastrointestinal issues. The American Academy of Pediatrics recommends that you wait a year to wean, and then the World Health Organization recommends waiting the 2 years. It's especially beneficial in developing countries. However, I want you to feel proud of yourself for however long you've breastfed your baby because you've offered benefits. So this is just some information for you to have, and you can do with it what you will, but if you're the mom who decided you just wanted to offer the colostrum on the first day, you did so much for your baby, and you should be proud of yourself for that. So, moving on to weaning that older baby and toddler. And I would like to say that what I hear from moms is that their older baby or toddler has become quite set in their ways with breastfeeding, and just like almost everything else in their life at that point. And so they have decided they want to continue breastfeeding, and you may be ready to change that relationship. And you've probably been thinking, are my breasts ever going to be my own again? So we can talk through that. Weaning is typically a natural process, and infants and toddlers may just wean on their own, but there are times when they don't, and so we want to do that gradually. Some women find that it can take 6 to 8 weeks to transition, so maybe have that in your mind as you prepare. It may take some time, and it typically does take time. Some women wean cold turkey, which means that they just stop offering the breast. There's no more nursing, but a lot of those women complain of pain, like engorgement, plugged ducts, and severe engorgement or prolonged engorgement could even lead to some mastitis and more serious health issues, so it's not recommended to wean cold turkey. This can be a process with you and your baby. So some of those tips for weaning gradually would include babies a lot of times have triggers, so you always nurse in the same chair at the same time of day. During the weaning process, you may want to remove that chair for a short time so that the child doesn't see that and then think, oh, I want to nurse. So you can change your daily routines a little bit as well, where they have those specific times where they like to nurse. You may want to change it up and do a different activity, or bring in your partner, family, grandma or grandpa, or even friends to maybe distract the child and have a different activity going on so that they're not thinking of nursing. What Marianne Neifert says frequently is don't offer and don't refuse. So don't offer to nurse, but if the baby is asking, or if your older infant is asking, then go ahead and nurse. It can be helpful to wear clothing that is a little bit harder access to your breast, so shirts that come up higher, and not necessarily button-downs or lower shirts during this weaning process. Let's see. Your child, as they transition, would benefit from you talking to them about this transition. You may want to let them know that they're getting older, and that means that they get to have more freedom, they get to go to grandma and grandpa's, and that breastfeeding is really for babies and those toddlers, and they're kind of moving on into doing more things. And so talk to your child about what's coming, what they get to do, and not about what they don't get to do, and talk about that being a good season that you both have loved, and now we're going into a different one. Remembering to offer 3 meals, 2 to 3 snacks, and water in between meals can also be helpful, so that they're not overly hungry or thirsty and then thinking, I really want to nurse. An additional tip that can be helpful is to set an alarm while you're nursing, so the child doesn't feel rejected by you just saying, I'm done, we're not breastfeeding anymore. You can set an alarm and say, okay, when this dings, we're finished. So you haven't rejected them, they just have a prompt that, okay, breastfeeding is finished for now. And so you just start slowly and slowly taking away some of those feeding times. Lastly, what's really important is to be flexible. If a lot is going on in life, let's say you're moving, or you're starting a new job, or you're sending the child to daycare or something, they may want to nurse more frequently as a comfort during that time. So that may not be the best time to be adamant about weaning. Additionally, if you notice that the child's behavior completely changes, you may be weaning too quickly for them. So add back in a couple more times of breastfeeding and be patient with them, and then start the process over again a little bit more slowly. If you have any questions, please comment, leave any questions, concerns, or experiences you've had with the weaning process of an older infant or toddler, and we'd love for other moms to learn from you. So be sure to join us again, same time, same place, Tuesdays at 10 o'clock. Bye.